Okay, so I'm just gonna read about the different types of classes. So for the class one, something that I found interesting was that the composite is put on by each cusp as they're putting the composite on. Some also used dams and others did not, depending on which tooth they were working on. Most of them did. Um, and others use extra materials like modifiers, like color modifiers, when they were fixing those restorations. For matrices, they used Toffelmeyers and wedges. Um, and for the isolation of the teeth, they used dental dams, the bow clamps, for that. And then the steps were they prepped the tooth, and then a lot of them used the air abrasion just to clear off the tooth from any extra of the enamel and stuff from the prep. After that, they etched it, they bonded it, and then they cured it. After they used something that was called a flowable. It said that it was used as a reinforcement agent, and they placed that right after they placed the bond, and it was cured. After that, they built up the cusps one by one, and then fixed them to like the desired anatomy of them. And then they also applied an easy glaze, and that easy glaze made the tooth structure shiny. Some post-operative instructions were no hard foods, and to wait to chew on that side. For a class 2, something that I found interesting was that I didn't know that G and V rings were a thing. I guess they're a type of isolation that you can use on the tooth, kind of like the bow clamps, and they have kind of like what you would use with a wedge, but it's already like wedged in. Like the clamp is, it kind of has like a wedge inside of it already, if that makes sense. They were used as a type of isolation. Also with class 2, others used way more steps than some. A lot of them did a lot more curing and adding of like bonding agents than others. And they also added composite one by one, while others just added the composite all at once and at the same time. For the matrices, they used sectionals, which is only used on one side of the tooth, and I don't remember ever like learning about that in class, or maybe we did and I forgot. Maybe we did and I forgot, but I should probably stop doing that. But they use sectionals, which would only be used on one side of the tooth, or they use Toffelmeyers and wedges. For isolation, they use clamps, dams, and then the G-ring, like I said, and then the V-rings as well. For the steps, they prepped the tooth, they etched it, they did a self-etch using like a scrubbing technique with it, which they would like do it really fast inside of that tooth. Then they cured it, and then they used a low shrinkable composite. Then they cured it again, and then used a different type of composite, which was called packable. And after that, they cured it. And then after they used the packable, they added more of the low shrinkage composite, cured it, and then did the final step of the more packable composite and cured it. They also then added the color modifier and cured it, and then did the final pack of the composite. And they used an HT shade to cover the restoration. They also added glycerin and final touch easy glaze. Something that was also interesting about that is that I didn't know that there was like a low shrinkage composite that you could use compared to like a packable composite. They were like in different cartridges that you could like squeeze out of too. Post-operative is to avoid hot foods and cold foods, no chewing on that side, and then refrain from brushing on that side or flossing in that area. For class 3 and class 4, on one video that I saw is one that they use when they put the dam on for those teeth, that they also put floss in between, and then after they flossed, like wrapped floss around them, they cut them off when the dam was on. I thought that was pretty interesting. It didn't really tell me why they did that. But they did do that, so I thought that was interesting. They also didn't remove a lot of the tooth structure. I feel like on some class 3 and class 4s, sometimes there's a lot of tooth structure that's missing, but for most of the videos, it didn't seem like they removed a lot of tooth structure from that. The matrices that were used were the Mylar strips. They also used sectionals and something called a soft wedge, which is just like a regular wedge, but made of, I think that they said it was made of like plastic. The isolation for those were the clamps, the dams, and then the wedges. So the steps for that one was prep the teeth, place the Mylar strip, place the wedge, clean and prep the tooth, and then they put on the etch, they rinsed it, they lightly dried it, and then applied the bonding agent. After that, they did an air brace to get the tooth roughened up. After that, they light cured and ended up placing the composite, and then after they placed the composite, they light cured again, and then they packed and contoured the tooth to its anatomy. They also removed the wedge and the Mylar strip. Post-op for that is sensitivity to hot and cold, just to bite gently and brush normal. And then for class 5, what I thought was interesting was that I never knew what an unicle was. I had never heard of that. Some of the videos showed it, and it's a type of matrix that is used. And a lot of them use the same techniques for class 5, and a lot of them sometimes use that extra bond as they did on the other videos as well. For the matrices, there was one called the cervical, copper band, and then an unica, which I thought those were pretty interesting. Like I said, unless we talked about those and I just forgot, but I think I kind of remember talking about a cervical one, but those were the type of matrices that were used for like class 5. So the isolation would be a dam, and then there was also one called a B5 retainer, and that one was pretty interesting looking too. It was kind of looked like a double-sided bow clamp, which I thought was pretty cool as well. And then just regular clamps could also be used. The steps for that one would be to etch, rinse and dry, gently apply adhesive, bond and cure, and add composite, and then pack into the prep, shape and cure. And then after that, sometimes in some videos and other videos, they added that glaze, but not all the time. And then post-op instructions was that they don't last forever, so to be very gentle with them, no hard foods, and nothing sticky.